Prime Minister said there's no easy solutions in battling this pandemic. He said there is no silver bullet, referring specifically to the New South Wales situation and the so-called national emergency now. Prime Minister Scott Morrison said he's been treating this as a national emergency for many, many months indeed. What he did say is that Pfizer second doses can now be spaced out to 6 weeks. They have been being administered at 3 weeks. They want to space those out to 6 weeks now to enable more people, particularly in Western Sydney, to get their first doses as soon as possible. Obviously, the push for the AstraZeneca vaccines too, of which there are plenty, is going on, with the Prime Minister encouraging younger people to speak to their doctor about the possibility of an AstraZeneca vaccination. Also, the Prime Minister as good as confirmed that he had offered military assistance to the New South Wales government. He says there's a standing offer effectively for ADF assistance should the New South Wales government want that, to assist with its super hard lockdown of some parts of Western Sydney or any other jobs entailing these lockdowns. But that's the latest from the Prime Minister in Canberra. Let's get on now with the rest of the Kenny report. And I was going to start off tonight by talking about this national emergency declaration by Premier Gladys Berejiklian in Sydney. That's been the big news about Sydney's COVID-19 outbreak today. There are 32 people seriously ill in hospital in Sydney, but a national emergency is the descriptor that the Premier of New South Wales has put on it, obviously because of fears it could spread much further. Now, I'm not going to repeat the news you've been hearing all day. Don't forget, though, of course, South Australia and Victoria are in lockdown too, so there's plenty to discuss tonight, especially when it comes to those vaccinations and a path forward. There's plenty of fear-mongering going on too, especially from premiers and other politicians and, of course, the media. But rather than cause for alarm, today, in my view, is a bit of a turning point. Today just might be the day the country accepts as the inevitable turning point when we might start to live with this disease, as, of course, we must do one day. Here's the rub. Today's announcement by the New South Wales Premier was incredibly significant because it essentially accepted that for the first time, we won't be able to get rid of this virus. Getting down to 0 cases just doesn't seem plausible anymore when you listen to what Gladys Berejiklian and her Chief Health Officer, Dr Kerry Chant, were saying today. This, as you know, is something that's always been inevitable. Australia could only, as we've been saying and hearing from experts since early last year, we could only ever delay this virus sweeping across our nation, not prevent it forever. We've done brilliantly as a country to essentially delay the onset of the coronavirus pandemic in this country until we've had vaccines available. And while everyone wishes vaccines were available or in everybody's arms now, as I keep saying, the most vulnerable are already vaccinated. So that is great news. In fact, that reassuring fact was finally given voice today by a senior official when the nation's health officer, Chief Health Officer, fronted a parliamentary inquiry.
So I'm not sure that you can say that our lockdowns are necessarily related to the vaccination rate. What we can say is that the protection of the elderly and the vulnerable has been achieved, and that is the most important goal of the vaccination. I don't think you can directly attribute the lockdowns to our vaccination rate. If we had been where we planned to be, which is 2 months, we're about 2 months behind our original plan because of the issues with AstraZeneca and international supply, it may well be that many of those states would have locked down anyway.
Very important comments there from Professor Brendan Murphy. As you know, he started this pandemic as the nation's Chief Medical Officer. Now he heads up the health department. But they're saying very clearly that the most vulnerable, those in aged care and the elderly, are protected already. That's such an important point and such a reassuring point for this country. He goes on to say that no matter what the vaccination rate is, we're still going to see lockdowns. So these lockdowns are always up for debate because there are so many issues involved in them, and the premiers, many of them, have been way too lockdown happy, if you like. Now, today, Gladys Berejiklian basically committed to the same timeline that experts have settled on this program, a timeline that looks at the next weeks. That is, that by October, the seasonal change and the extent of vaccinations throughout the country might allow us to put heavy restrictions behind us.
That means that we need to live as freely and as safely as possible during August, September and October. According to the federal vaccination rollout, by the end of October, we will be at a stage where much more of our population will be vaccinated and we'll be able to live much more freely beyond that point. But we have to provide a roadmap to our citizens as how best we can live freely, but also as openly as possible.
Yeah, so the big question is what life will be like in Sydney between now and the end of October, because contrary to the fearmongers, no one, and certainly not me, has ever argued for a so-called let-it-rip approach. The question is how to slow the spread and quell the number of cases until we get to a place in October or November when the weather and higher vaccination rates gives us much more confidence to open up properly. For now, the Sydney lockdown is likely to be extended beyond the end of this month, and the super lockdown of those 3 local government areas across Western Sydney and southwestern Sydney has now been expanded to cover 2 more councils, Blacktown and Cumberland. So the trend for now is tougher restrictions. We'll learn more next week about this so-called roadmap in New South Wales, but let's hope that at the very least we can get schools going back, because it's just wrong to be doing so much harm to our children when the disease poses no serious threat to them. There's another big push on for vaccinations, as you heard too from the Prime Minister, especially on AstraZeneca. We are awash in this country with AstraZeneca, the vaccine that saved the UK, but this country's really stuffed up the use of this particular vaccine. We've scared people away from it, and now most governments are urging people to have it, especially anyone over 40, rather than just those over 60.
I've had the AstraZeneca jab. The Chief Medical Officer, Dr. Chand, has. Minister Hazzard has. My parents have. The AstraZeneca is a very, very effective vaccine.
Yeah, and I've got to say, the whole idea of people having to book in for vaccinations seems to me an unnecessary hurdle. People should just be able to get in a line, turn up and get the jab. In fact, we've had more than 80,000 people each day turning up for COVID tests in New South Wales and across Sydney over recent days. I don't see why they can't get a jab at the same time they're queuing up for testing. Why aren't testing stations around the nation actually vaccinating at the same time? Meanwhile, when dealing with the virus and outbreaks is all quite inevitable, we all know we have to deal with these things. We know there'll be outbreaks and restrictions. When we should be calmly going through the next steps, we get this from the Victorian Premier.
Sydney is on fire with this virus, and we need a ring of steel put around Sydney.
Sydney's on fire, and he wants a ring of steel around Sydney. It defies belief that this bloke would seek to lecture the other states. For the record, Victoria has had 3 times more coronavirus cases than New South Wales during this pandemic, even though New South Wales has hosted 3 times as many people through hotel quarantine. Victoria's had 5 lockdowns for a total of 3 times as many days as the other states. And Victoria has had about 8 times as many deaths during this pandemic than the rest of the country combined. And if you reckon Daniel Andrews has a nerve, what about South Australian Premier Stephen Marshall announcing 1 new case today, yet still talking about super spreader events? This is a government that has locked down for nothing before, and the state is now locked down for 1 small outbreak. And incredibly, it's been forcing people who attended a restaurant and a winery where there were infections, it's been forcing those people out of their homes and into hotel quarantine.
I think we just have to remember we are in a public health emergency at the moment. I don't think we're putting people in against their will. In fact, we of course can, under the Emergency Management Act, direct people into quarantine.
Some of these people have tested negative and they're forcing them out of their homes into hotel quarantine, and yet there's no uproar in South Australia. What have we become in this country? This is a Premier who's talked about catastrophic consequences for his state, ramping up the fear. He does face an election early next year. There might be something in that. There was 1 COVID death in this country today. Sadly, an 89-year-old man died in New South Wales. We've now had 6 COVID deaths in this country this year. Compare that to the rest of the world. And remember, the average age of coronavirus deaths in Australia is 2 years higher Yes, 2 years older than the average life expectancy in this country. We should keep calm and get everyone over 70 fully vaccinated. We're actually 3/4 of the way there now. You heard from Brendan Murphy how well we're doing in protecting the vulnerable. So the rest of us should get cracking too. But we are in a very good place in this country, and spring can't come soon enough.